Thank you all for joining us this evening, both those of you that are in the room, as well as those of you that are online. Tonight's speaker is Steve Carter. He's I believe the president of Carter Group's Tax Services. He has 25 years of experience in tax accounting, professional tax specialist, federally licensed by the Department of Treasury, who's authorized to represent taxpayers with the IRS.
Right.
That's impressive. I hadn't had a chance to read his bio, so I'm actually going to have him to just give us about 2 minutes of his background and then go right into his presentation.
Oh, really?
Yeah.
Well, we have a bookkeeping and tax practice in Richardson. We're a small firm. We do payroll and bookkeeping and compliance. The effects of the healthcare related provisions of Obamacare affect all businesses and individuals, and so what we want to talk about today are those effects and how they pertain to small business. I have a couple of handouts that you can kind of follow along.
Go ahead. Or you can go ahead and start.
Okay. I need a little interaction, so
Okay.
so that'll help the discussion, guys, if you will. Yeah. And so I've put together a couple of pieces and a slideshow to talk about.
Okay.
There you go. All right. The federal agencies that are going to deal with the Affordable Care Act are the Department of Health and Human Services. The lead federal agency for health care insurance coverage, financial assistance, the health policy and educations. The IRS component will administer the tax provisions and also the credits. In doing research, you can go to the next slide, there are some resources here. These are websites. Healthcare.gov is a new website. It actually opened on October the 1st and is online, even though I think there's still at this time a government shutdown. But the online is online, so aren't we glad for that? The next. What we want to talk about is we're going to separate this into two groups: the employers, businesses, and then the individuals. What employers need to know depends on the size of the employer, and there is a definition of an applicable large employer, and if a company is an ALE, then they have certain provisions that they have to respond to. The ALE are employers that have employees greater than 50. Those employers, depending on, go back one, I'm not going that fast. Depending on the tax provisions, there's two provisions that a large employer needs to do: information reporting, and that information reporting includes the health care information for the employees. It also has a shared responsibility provision for large employers, and then the small business tax credit is available for small employers.
Small being what size?
Small is going to be defined later in a few more slides.
Okay.
But we'll talk extensively about small employers versus large employers. You can go to the next slide. The definition of the large employer, as I said, is an average of 50 or more full-time employees, And when we talk about full-time employees, we talk about where there's a definition for full-time equivalents. We need to bring that point out. The full-time equivalents are going to be an average of 30 hours of service a week or 130 hours in a month. That would be a full-time employee. The full-time equivalents would take the part-time, go to the next slide.
Mm-hmm.
The full-time equivalents would take the part-time employees and it would divide the number of hours of their service by 120, and it would multiply all of those full-time employees and come up with all of those part-time employees, and come up with a number of full-time employees. We add the full-time and the full-time equivalents to get a sum. If we are equal to or greater than 50, then we are an applicable large employer, the ALE. And there are special rules for controlled groups. So if you're a part of a controlled group, one employer has more than 50 and one employer doesn't have more than 50, the one that doesn't is going to be combined. There are some special rules under that Treasury regulation, which is that footnote there on that slide. For 2014, what employers need to know is that the two provisions, the new information reporting and the employer shared responsibility, those have both been delayed. That was put into place so that they're not effective until 2015, and they would be reported in the 2016 year. Originally, we were going to start accumulating the data for 2014, and they would have to report everything in January of 2015. The employers were delayed by 1 year. That was an act of Congress, and so that is relief for them from these tax provisions. Go to the next slide. They have asked that voluntarily they could apply these provisions for 14, and what is required is the filing of an annual information return with the IRS. That annual information would also send a copy to every employee. These would be like your W-2s that you get. It would also be like the 1099s. They're going to show the coverage, the coverage that's offered, the lowest premium cost, the number of full-time employees for the company, and the information that would be displayed by month. We'll get to the requirements of the individual, but it is a monthly requirement for the individual mandate for health care coverage. The Affordable Care Act does require an employer to provide coverage, does not require an employer to provide coverage, but however, a large employer would have a employer shared responsibility payment, okay? And there are a couple of provisions that need to look at if the employer does not offer coverage to at least 95% of its full-time employees, or the employer offers coverage to its full-time that's not affordable or doesn't provide a minimum value. One of those, and at least one full-time employee receives a premium tax credit. Now, a premium tax credit we're going to get to later in the individual section, but that is the assistance when an individual goes and purchases health insurance from the marketplace, and they can't afford health insurance because they don't make enough money. They could qualify for a premium tax credit, which would help them offset their cost of insurance. That's an individual provision, but if an employer is a large employer and has one of its employees get a premium tax credit, then that employer doesn't offer coverage to more than 95 or has unaffordable coverage. The combination of those three events could trigger a shared responsibility payment. Okay?
Now, the employer would have to assist in addition to
the employer would have a shared responsibility payment. Now, the interesting thing, let's go on to the next slide. The interesting thing is the payment is there's no way for the employer to report or include this payment with their tax return. Okay? And there's no provision right now for that payment. It's if the IRS believes that based on all of the information that it gets that a payment is potentially due, then the IRS will contact that employer to review the facts and determine the payment, if any. So we're a little afraid of that provision because it's a little ambiguous. When they decide, and if they decide, and they review all the information, then the employer could be subject to a payment. So the employer, large employers, will not know if they have a payment due, even because of the employee went and bought health care coverage, all right, and that would be an individual thing, not a company-related thing. So a large employer wouldn't be privy to that transaction, but he could get a penalty, which is the employer shared responsibility, because if it was a large employer, he should have had some type of health care coverage in place for his group. So, question, I see the pressing questions. So
well, I guess if I'm the employer and I have 75 employees,
yes.
and somebody goes out and purchases it, the government subsidizes it.
Yes.
I don't know that.
Correct.
Would I know that in in the calendar year, or I'm actually incurring?
No.
So does the penalty fall back to the previous year? Or how is it?
Well,
I'm thinking about
penalty,
accounting and mapping.
Yeah, the penalty isn't identified, and the employer shared responsibility payment isn't even determined until after a complete review of all the facts and circumstances. And again, this was all delayed for another year. So while we've all anticipated the 2014 start, for the businesses, they've been given a reprieve. So we will not start this accounting and documentation until 2015, which means it'll be reconciled in 2016, which means sometime in 2017 you might get a bill from the IRS on your shared responsibility payment for your employees. So
that actually occurred 2 years ago.
It actually occurred 2 years ago. Yeah, going to be fun. A fun accounting problem
The accountants
to have.
Employed.
Well, yeah. There you go. So let's move on here and see what we get into. Now, the employer shared responsibility provision does not apply when there's less than 50 full-time plus full-time equivalent employees. So if they're an employer below 50 full-time employees, and it's full-time plus full-time equivalent is below 50, then we're not up under that. If we are small and below the 50, we may purchase health care coverage through the Small Business Health Option Program, which is acronymed as the SHOP. And the SHOP is a place where small groups can purchase from the new marketplace that just opened on October 1st of 2013. Also, a small business, and we'll talk a little bit more about this in a minute, is the Small Business Healthcare Tax Credit. That is available for small employers. Okay? Now, as I said, the shops, go to the next slide. The shops began on October the 1st, and they are part of the new health insurance marketplace. And it's a streamlined way for small employers and small tax-exempt entities to shop for healthcare insurance. And that website there is the healthcare.gov/marketplace. Okay. To qualify for the small business healthcare tax credit, and this was the question you had asked earlier, I believe, the credit is available. It with fewer than 25 full-time equivalent employees. That you pay an average wage of less than $50,000 a year. Pay at least half of the employee's health insurance premium. So that credit for small businesses, if they have less than 25 full-time equivalents, okay, that would be full-time plus the part-time multiplied up to the full-time amount.
Right.
if you're less than 25 and you pay an average wage of less than $50,000 a year, then and you pay part of a group health insurance premium, then you would qualify for a credit. Tax credit.
Okay.
Okay. Now that has been in place. Come on. In 2010 and 2000 through 2013, that credit was 35% of the premium contributed by the employer. It's also available as a refundable tax credit for tax-exempt entities at 25%. So a tax-exempt organization that provides health care to its workers could qualify for a tax refund even though they didn't have any tax paid in. It's a refundable credit for tax-exempt entities.
College, university, hospital, nonprofit hospital.
Taxi, but they would have to be less than 25 employees.
Okay, then they got
Okay,
you.
so,
I got you.
So small nonprofits, less than 25 employees,
Okay.
provides health care coverage to that group. They would qualify for a credit that is available. Employers can the credit is for 35% of the premium. They can still deduct the remainder as a deduction. You can't deduct and get the credit both. And smaller employers get a larger credit if the average wages are $25,000 or less. So that the credit phases out on a sliding scale as wages increase from 25 to 50, and as the number of employees increase from 10 to 25, that credit is on a phase out. So it does create a sliding scale. Is there a question, Chris?
I'm trying to put it together.
It's all right.
Well,
Now,
I'm trying to distinguish between the small employers versus the tax-exempt entities.
Well, the tax-exempt entities would qualify, but I believe they would still have to qualify as a small employer, which would be limited to the dollar and the number of employees and the dollar that they pay. Okay. If they were paying more than that, then they would obviously a tax-exempt entity could qualify to be a large employer if they had more than 50 employees. Okay. Starting in 2014, the maximum credit goes up to 50% from 35%, or 50% and 35% for the tax-exempt entities. Okay, but in 2014, you must buy the coverage through the shop, which is at the healthcare.gov/marketplace, and then this credit at 50% and 35% for the tax-exempt can only be claimed for 2 consecutive taxable years.
It almost sounds like they're forcing the country towards a single entity healthcare.
Well, it's Health and Human Services at healthcare.gov, and they are the controlling entity.
You don't want to say. But it sounds like they're either incenting or pushing
shops.
This right here.
Yeah.
That's what's getting me, and it sounds like they're pushing the country in a particular way for small.
Oh yeah, there's more.
Okay.
Let's go on. Now remember, employer also have a new information reporting requirement, and that's been delayed. Let's go to the next slide.
Okay.
It's been delayed for 1 year. The new information reporting requirement, which is code section 6055. It's been delayed for businesses for 1 year, but what is this information reporting? We talked about it a little bit earlier, but it is the health coverage provider. Who is the health coverage provider? The health insurers, the self-insured employers, sponsors of the self-insured plan, and governments providing a minimum essential coverage. Minimum essential coverage becomes a requirement for health plans. They have to provide minimum essential coverage. Okay. Information report on minimum essential coverage actually provided to covered individuals. So they'll have to transmit annually to the IRS with a copy to the individual. This is like their W-2, like the 1099s. There's going to be a new document that we'll have to transmit. It was originally to be filed in 2015 for the 2014 tax year. We've been extended for 1 year. The filing rules are similar to the rules for other information returns. It's due by January the 31st. It's done at the end of the year. But the problem was we had to start tracking all of that in January 2014, so that was less than a quarter away, and our systems aren't quite ready for that. We've got some things. Okay.
Did I skip one? Okay.
So also this quarter, and it should have occurred already on October the 1st. All employers, whether they're small or large, all employers that are subject to the Fair Labor Standards Act, okay, the minimum wage and overtime rules, if you're subject to that, then you are required to send a notice. Okay, this is driving your employees to send a notice to all employees about the healthcare insurance marketplace. Okay, and that depending on their income and their coverage offered by the employer, they may be able to get a lower cost private insurance at the marketplace. And that if they buy insurance through the marketplace, they may lose an employer contribution, if any, to benefit. They may lose the employer contribution from their health benefits. So if the company pays part of the health insurance, if you buy it from the marketplace, you're not going to get the employer contribution if they're paying some of the insurance. But all employers had to notify all employees of their, either we have insurance and what kind, or we don't have insurance. And so small employers with 1 or 2 that didn't have a group policy had to notify all of their employees about the health insurance marketplace and to give them company information that declared they did or did not have a health insurance policy group plan in place, and who could be covered or who's not covered.
And was it also a requirement that they notify employees if they were going to be modifying their plans? Because I know of some individuals who were notified that their plans were going to be changing. Now, they didn't have the detail.
That's part of the notification.
Okay.
Yeah, that is all part of that notification. This is all under the Department of Labor, the DOL.gov, and there is some additional guidance for employers on that website. But yeah, that is, the employees basically was to inform the individuals, all right, and this is my segue to the individual plan, but to confirm or to let the individuals know that the marketplace exists, and that was a requirement amended to part of the fair. If you were qualified under Fair Labor Standard Act, then you had to notify all of your employees. So if you haven't done that, then you may need to do that as an employer. But insurance companies were aware of it, tax office, payroll. So this should have happened, but we're really close here. The Fair Labor Standards Act, there's not a penalty identified on that, but it was a requirement. And then any new hires going forward would also get that same information about the insurance for the employer as well. Okay? So we're going to transition now from businesses, and we're going to talk about individuals and the provisions that affect the individuals. Let's see, where am I? Okay. Any questions? Businesses. Any business questions, gentlemen?
Any questions online?
Maybe they're still there. Okay. What do we need to know as individuals? What do we need to know about 2012 and 13 taxes? There is nothing related to health insurance coverage on 2012 and 2013 tax returns. Okay? The healthcare insurance coverage, we're to be prepared for notices that the individuals will receive from their employer. Okay, and this was part of what their explanation of coverage available, how to contact the marketplace, and the potential eligibility for premium tax credits. Okay, that's provided by the Department of Labor. Okay, so the insurance marketplace opened on October the 1st and provides access to health health insurance information, and it's a new place to purchase health insurance, including eligibility for financial assistance and public insurance programs. All right. There's one process now to determine eligibility for individuals, and so it really isn't a taxing piece. This is more of an insurance piece, but it's Medicaid, CHIPS, financial assistance to the marketplace. And this is a new provision, is the PTC, the premium tax credit, can help lower the premiums for individuals that purchase, and the cost sharing reductions would all be determined at the marketplace, which is on healthcare.gov. The individuals need not file a 12 or 13. If your income was low, you don't need to file a tax return if you weren't required to file one to receive financial assistance at the marketplace. Okay, the premium tax credit. The premium tax credit can be received monthly in advance to assist in paying for health insurance premiums. So that's a benefit. It requires a reconciliation, kind of like your income tax withholding, on the tax return at the end of the year. And in order to qualify for a premium tax credit, you must enroll in coverage through the marketplace. But this is going to be on 2015, when we do the 2014 tax returns in that January, February, March, April of 2015. Anybody that received a premium tax credit is going to have a tax reconciliation model on their tax return. That's something to be aware of. Okay. And that reconciliation is going to come in the form of an advance premium tax credit. Advance payments are made directly to the insurer, so it's not money that they would have seen, but they have to be responsible to be able to report those, and it will reduce the out-of-pocket expenses for monthly premiums. Okay.
Is there a hole there?
Yeah. Well,
I could see the insurance company.
What if you underestimated your income, qualified for an advance premium tax credit? Your income puts you out of the realm to qualify for the premium tax credit. When you file your return, you could have an OBAC.
And a big one.
You could. Yeah, could, depending on the total cost of health insurance coverage for the whole year. Yeah, it could.
But you weren't. Let's say you're not eligible, and the government has paid in that subsidy you thought you were eligible for, is going to the insurance company.
Right.
But you end up paying the government back.
You will have to.
What happens to the money that went to the insurance company?
Well, they paid the premium for the insurance. So you got insurance, though.
Okay.
Okay.
So you make the government whole, basically.
If you don't qualify for the subsidy.
Got it. That was somebody dropping off.
Okay.
Keep going.
All right. The advanced premium tax credits, let's go on to the next one.
Okay.
And determination of the advanced premium tax credit eligibility is all done through the marketplace. Okay, so the premium tax credits for 2014 are based on projected family income and size for 2014. So if you have a birth, a child born, then your family size would be determined on your 2014 taxes. So if you get married during the year, then your family size would be different. Or if a dependent got married and she left her parents, a son or child left their parents' return, then all of those would reconcile on 2014 tax filing. Okay.
Prorated?
Yeah. No, not prorated, because they're dependents.
Okay.
Well.
But I mean, if it's only qualifies for a fraction of the year, you get married in July.
Yeah, but your dependent exists,
okay.
And so the dependent would go for the whole year.
Okay.
So, yeah, prorated. It's a monthly requirement to have health insurance, so everyone would have to meet that requirement. Children can remain on their parents' return now to 26 too, so they might not even be a dependent, but they would have to be notified or have their insurance slip to report on their insurance.
And that's if they're students.
No, 26 for any reason.
Okay. Wow.
Part of the Affordable Care Act.
Wow.
Yeah, information provided on the application will compare to IRS data and the data of other federal agency that's appropriate. So there's a large, that point number 2 there is a large amount of data that has some people in concern as who has access to that data. What is the privacy place? I mean, is it secure? So we report changes in family and income circumstances at the marketplace. So that's where we're going to go and store that, which is at healthcare.gov. So it's a whole nother huge database of information on the American people.
And the marketplace is
where you buy insurance.
It's exclusively a government entity, or?
Yes.
Okay.
Yes. Okay. All right.
The more I know, the less I like it.
The individual shared responsibility. All right. Here it is. This was the controversy. The individual mandate. And the individual mandate was what went to the Supreme Court. That was what withstood the Supreme Court, and that says that starting in 2014, everyone must either have minimum essential health coverage or have an exemption to having coverage, or make a shared responsibility payment. And then that shared responsibility payment would be like the penalty. Just clicker.
I'm trying to have to read it. I know that's
Just get it on low. Click on her mic right in the bottom corner.
perfect.
You gonna unmute me? At the top. Yeah. Okay. All right. How we doing, folks? Oh, they can't even talk because we can't hear them. All right. So.
Because they're all muted right now.
They're all muted. All right. I see. I'm missing the interaction, I'll just say.
Todd Miller just said better now. Because you can hear all that.
Oh, I know that's. All right. So, the individual mandate, the shared responsibility. Let's look at the next slide. We'll go through these pieces. Minimum essential coverage. Minimum essential coverage includes any employer-sponsored plan, including COBRA and retiree coverage. Those would all qualify. Coverage purchased in the individual market on the new marketplace, that would be an example of Medicare, Medicare Advantage. Those are all minimum essential coverage. The CHIPS and Medicaid are both, and TRICARE for the veterans. Those are all part of the Medicare, the minimum essential coverage that would qualify. So though, if you have one of those, then there's no shared responsibility payment, and you're good. If you don't have one of those, then you need to consider an exemption. Let's go to the next slide.
Can I ask a quick question?
Yes.
And I know we're running out of time. A retiree who already has a structured retirement medical plan in place, if it doesn't,
it's going to qualify for minimum essential coverage.
Okay.
If it's a retirement plan, it's going to qualify.
Okay, cool.
Okay. So if you don't have a minimum essential plan, you could claim an exemption, and the exemptions for coverage are members of religious groups consciously opposed to insurance benefits, or recognized healthcare sharing ministry, or the Indian tribes. Okay. If you have no filing requirement, if you had a short gap, that's going to be an exemption. If you're suffering a hardship, okay, they're going to give you a pass. Did not have access to affordable coverage, so if you couldn't afford it, if you were incarcerated or were not lawfully present in the United States, then those would be your exemptions. Your exemptions would apply if you didn't have a filing requirement, or you needed to apply an exemption. Those would go to the healthcare.gov. You go back to the same place to get the exemption. Okay. Reporting coverage for exemptions or making payments. There's no reporting until 2014 tax return. Okay. We're going to report our health insurance information in 2014. That'll be on the 2015 filing season. And if payment, if due, will be reported and paid just like any other taxes. Okay, there'll be a statement that's provided to the individuals. That statement will have a health marketplace. We give them place to claim the premium tax credit and to reconcile the advanced premium tax credit. So the insurance companies are going to provide a statement, or the health insurance marketplace will provide that statement. The health coverage providers would give proof of, kind of like we carry car insurance. We have proof of car insurance. We're going to have proof of our health insurance. We have insurance cards, but this will also have to be provided monthly for health insurance because it is a monthly requirement. Large employers would provide a statement to their employees, and all these statements should be provided to the individual no later than January 31st, 2015 for the year 2014, which is where we're in. And I think that's part of the debate in Congress. Can we get a reprieve for one more year?
For the individual side.
For the individual side, yeah. Let's put it off one more year for them and then let everybody think about this a little more. Advanced premium tax credit recipients must file to reconcile. I'm going really fast. I only got one more. You're done. Other items that individuals may have to include on their insurance would be the insurance coverage, establish or claim an exemption, and also claim the premium tax credit. If you didn't get an advanced premium tax credit, you could get a premium tax credit, which would give you another tax refund on your tax return if you had the insurance. So that would be available too. Okay. Additional resources, and this is the last slide, would be the IRS.gov ACA is the Affordable Care Act. Healthcare.gov we talked about. The SBA has some information, and the Department of Labor, the DOL.gov, is a resource for employers. So I also have one more handout I will make available to you. You can add that online. Okay. And this was an article in the Dallas Morning News. I found it to be very informative about the Affordable Care Act and you. Yeah. And so I've got that also on the documents. We'll add that with the slides, so that would be available. I didn't really refer to it because we didn't have a full audience they could see the same document. So, okay.
And any quick questions from the audience in the room? And I will pull up the other thing. Any quick questions? Let me see if everybody's on. I'm unmuting you all. So, are there any questions from the remote audience?
This is Bruce.
Okay, Bruce.
One of my questions seems to be, hey, if we're going to cover everybody that's kind of been outside the system, or that's the goal, you're guessing that, or I would guess that some of those people are people who not just couldn't afford insurance maybe, but couldn't get insurance because whatever pre-existing conditions, or having cancer, or whatever their issues were. So it seems very affordable, $200-300 a month for health insurance, and now we're going to cover all these people who weren't covered before. Is that really a viable system?
I don't know if it's going to be viable, but I do know that they will have some rules on the insurance. What is covered and what is not covered, and how to deal with pre-existing conditions. And there may be a delay in covering some of those pieces. An insurance guy can answer that much better than I can. I'm more of a tax guy on how do we reconcile these tax credits and or get the tax credits.
Okay.
And Bruce, this is Royce. That $300 is way low. My wife got a letter from Aetna. We're currently paying $294 for her a month for her insurance. She's 64 years old. Aetna's offering us to be able to stay on the current plan by re-enrolling in December, and that will be $495 a month. If we go to the ACA starting in January, it's going to be $795 a month.
Wow.
Yeah,
Wow.
that's, okay, so I'm not sure everybody can afford it then.
Yeah.
But if you go through if you can afford it and you go through the healthcare.gov marketplace, you could qualify for a subsidy, which would be a part of a premium tax credit. And again, what the coverage, there's the way I understand it is there's 3 levels of coverage, and those levels pay a 60, 70, 85, 80 or 90% care, kind of like a hospitalization insurance, and have a variety of different deductibles and things that you would be able to choose from.
Okay, thank you.
No wonder people are so confused.
It was talked with sometime in text. But yeah, it's going to be fun, huh?
And guys, Rick, you have a quick
I was
question?
saying, it looks like almost a little less than a quarter of the DFW population has no health insurance. And the Medicaid kind of puts that up to about a quarter.
Right, based on that graphic.
Yeah. So that's going to mean a lot of people trying to sign up. I was listening to NPR. They crashed the site, kind of, I guess. There's so many people going on the site.
First couple of days.
And they took it down last night for maintenance, and they expanded it so people now only have to wait about 30 minutes when they put them in a waiting room when they go online and eventually get to them, I guess. So
Wow.
It's interesting just how many people are checking into it, but I'm sure there's other people who just don't care, won't respond, and aren't going to be able to afford anything.
Well, open enrollment lasts between October 31st through March 31st, and then that would close open enrollment. And if you had a life-changing event, then that would you could re-enroll between March and I guess October of the next year.
I'm sure we'll see those extended.
All right, thank you, folks.
Thank
for
you.
for letting me come.
Let's do our 4-way test to close out the meeting.
All right.
Of the things we think, say, and do. First,
Is it the truth?
second,
Is it fair to all concerned?
third,
Will it build good and better friendships?
and fourth,
Will it be beneficial to all concerned?
Our meeting is now adjourned.